Good day! I am Nicole COLOT from BSN 2B, and I will be demonstrating on how to do a pap smear test. Good morning, ma'am. I am Nicole COLOT, a student nurse from Central Philippine University. May I know your name, ma'am? Okay, Mrs. Ilustre. So today, ma'am, I will be performing a pap smear test that is the most common test used to look for early changes in cells that can lead to cervical cancer. It involves gathering a sample of cells from the cervix. So, ma'am, some procedures might be uncomfortable to you, but don't you worry, I'm here to assist you and will provide complete privacy. Is that okay with you, ma'am? Okay, so I'll just provide privacy. The following materials are needed for the test. First is the vaginal speculum, then the sterile gloves, 2 glass slides, a cotton tip applicator, iris spatula, cytobrush, KY jelly, 2 labeled containers with 95% alcohol, and a waste receptacle.
Place the client in the dorsal lithotomy position and feet resting in support called stirrups. Put on gloves and observe the aseptic technique throughout the procedure. Warm the vaginal speculum and lubricate it with KY jelly. Hold the speculum between 2 fingers with the handle pointed backwards. Instruct the client to take a deep breath before inserting the speculum.
So, ma'am, I'll be inserting the vaginal speculum, but before that, I want you to take a deep breath.
Facilitate the insertion by placing 2 fingers into the introitus and press it down. Insert the speculum by placing the transverse diameter of the blades in the antero-posterior position and guiding it in a downward motion with the tips pointed towards the rectum. Once the blade is inserted, turn the speculum so that the transverse axis of the blades is in the transverse axis of the vagina. Insert the blades fully. Visualize the cervix as you slowly open the speculum by twisting the screw adjustments on the speculum's base. Inspect the vaginal canal whether the epithelium is noted for evidence of erythema or lesion. Gently remove excess mucus with the use of a cotton swab. Sample the endocervical canal with a cotton tip applicator or cytobrush, which is placed into the canal, and rotate it to 360 degrees. Smear the material obtained thinly on a glass slide by rotating the swab or brush. Label it with the client identification and the specimen name. Fix the slide immediately by immersing it in 95% alcohol. With an iris spatula, scrape the entire transformation zone and smear it thinly into the second slide and label it and fix it immediately as well. Remove the speculum by twisting the adjustment screw and slowly pulling it halfway and close the speculum, turning the speculum sideways and remove it gently. Inform the client that the procedure is done.
The procedure is now done, ma'am. Thank you for your patience and cooperation.
And discard the contaminated materials properly. Label and secure the specimen before sending it to the lab.